Greetings of the day, folks. Today we are going to discuss about Wilms tumor and also retinoblastoma. So, coming to the Wilms tumor of nephroblastoma is a malignant embryonal renal tumor that affects children predominantly under the age of 5 years. Overall survival rates are excellent at approximately 90%. So, clinical features, the presentation is as like have an asymptomatic abdominal mass noted while dressing or bathing the child, as opposed to neuroblastoma, given that the age group and the abdominal mass at the presentation can be similar. Children often appear remarkably well with no systemic symptoms. Hypertension due to increased renin production is present in 25% of cases. There can be mass effect from the tumor, leading to respiratory distress or intra-abdominal obstruction. Less common symptoms include anorexia, weight loss, emesis, or hematuria. Metastases at the time of diagnosis are uncommon but can occur to lungs, liver, or lymph nodes. Okay, so coming to the diagnosis and treatment, we must obtain basic laboratory studies, urine catecholamines to rule out neuroblastoma, and obtain a chest X-ray to identify pulmonary metastasis. Ultrasonography is appropriate for the initial abdominal imaging in the ED, although vigorous or excessive palpation of the mass can cause tumor rupture. CT or MRI identifies the extent of the disease. Definitive treatment is surgical resection and chemotherapy, with or without radiation therapy. So here you can see a 7-year-old presented with huge abdominal mass and respiratory distress. The pelvic CT scan followed by laparotomy confirmed the mass as a Wilms tumor. Because of the retroperitoneal location of the kidney, these tumors can be quite large at the diagnosis without significant impingement of other vital structures. Right-sided pleural effusion due to metastatic disease. Almost complete opacification of the right hemithorax with mediastinal shift to left can be seen. Okay, so now coming to, so in summary, so you must see that there will be abdominal mass that will be asymptomatic, and sometimes in patients can be seen you can find hypertension, and there can be some mass effect which leads to respiratory distress in the thoracic cavity or obstruction, and patients will be having a chronic the cancer symptoms like anorexia, weight loss, emesis, or hematuria. So metastasis can be seen. They're uncommon, but can occur to liver, lungs, and other sites. Now coming to the retinoblastoma. Okay, so retinoblastoma. 1 second, please. Yes. So retinoblastoma is most common pediatric intraocular malignancy, with 90% cases diagnosed in children less than 3 years old. There are both heritable and non-heritable forms. Okay, so retinoblastoma RB gene was first tumor suppressor gene discovered in the human genome. Heritable forms are usually due to germline mutations in the RB1 gene and present within first year of life with bilateral disease. The majority of cases of non-heritable disease are unilateral. Okay, so coming to the clinical features, you may find leukocoria, that is white pupil in which white light reflects off the tumor instead of a red light reflecting off the retina. It's the most common presenting sign. Okay, so I will show you later on. Okay, so we'll see the figure later on. So this may be noted by the primary physician or occasionally by the family members. When they note leukocoria in the photographs, other signs may be include strabismus, decreased visual acuity, redness, pain, glaucoma, and proptosis. Young children do not often report visual complaints. The retinoblastoma can spread into the surrounding orbit as well as metastasize into the CNS and viscera. So, how do you diagnose it? We may diagnose the case as the leukocoria or other signs suggestive of intraocular tumor are noted. You must consult ophthalmology. Okay, definitive diagnosis is usually obtained by exam and imaging under anesthesia. Obtain a CT or MRI if there is evidence of orbital inflammation. Treatment options depend on the extent of the disease and include enucleation, chemotherapy, cryotherapy, brachytherapy, thermotherapy, radiotherapy, and laser photocoagulation. This concludes the video. Thank you very much.